What if I told you some people are being treated for the wrong type of diabetes without even realizing it? Not because doctors are careless, but because what's actually driving their condition doesn't show up the way we expect. And this happens more often than you think. I've seen people come in diagnosed with type 2, doing everything they've been told to do. They clean up their diet, they take their medication, they follow the plan, and on paper, it looks like they're doing everything right. But something doesn't add up. Their blood sugar is unpredictable, their energy doesn't improve, or their numbers just don't respond the way they should. So the assumption becomes they need more medication. They need to try harder, but that's not always the issue. Because sometimes it's not the treatment isn't working, it's that the label doesn't match what's actually going on in their body. And when that happens, people can spend years trying to manage something that was never fully understood in the first place. Hey, I'm Dr. Jason Shumard, and I've spent the last 20 years working with people with type 2 diabetes, helping them understand what's really going on inside their bodies. And over time, I've started noticing something that didn't quite make sense. There were patients doing everything right, but their results didn't follow the pattern we typically expect. Now let's clarify something first. There are different types of diabetes, type 1 diabetes, type 2, and other recognized forms of diabetes, each with different causes. But even within type 2 diabetes, not every case is driven by the same mechanism. Most people know about type 1, and this is more of a condition where the individual's pancreas is not able to produce the insulin. So they are considered a insulin dependent. Their body needs insulin because their pancreas can't produce it. But type 2 is totally different. These individuals can produce insulin. It's just their cells are not able to accept and utilize the insulin to allow the cell doors to open to allow the sugars to enter from the bloodstream into the cells where they belong. And if that can't happen over time, many cells, the sugar starts building up inside the bloodstream. Type 2 is not one size fits all, same diagnosis equaling same cause. This is where confusion begins. And this is where things get interesting because there's a subset of people who are labeled as type 2, but their body isn't primarily struggling with insulin resistance. Instead, what they're seeing is something different. Their body is not producing enough insulin effectively in the first place. You can think of this as a different pattern of type 2 diabetes, sometimes referred to as a more insulin deficient form rather than insulin resistant. And if you treat those two the same way, you can see why results don't always line up. So this type of individual requires a much more different approach. We need to identify the mechanisms that are going on. Inside the pancreas, you have what are called the beta cells. And oftentimes, this could be a situation where something's happening with those beta cells. Sometimes this can be a chronic inflammation problem that's pushing and aggressively attacking the beta cells and reducing the amount of insulin being released. Sometimes it could be a chronic infection pattern or toxicities negatively impacting the pancreas and its ability to produce insulin. And sometimes it can be the own immune system, actually attacking and destroying, creating an autoimmune disease that can lead to this person to becoming a type 1 over time. It's an atypical presentation within type 2. It doesn't always follow the classic insulin resistance pattern and can involve deeper metabolic dysfunctions. And this is why standard treatments don't work, because standard treatments are focusing on trying to lower the sugars, and it oftentimes do a good job. But in this situation, you can lower the sugars with pharmaceuticals, but is that ever going to fix the pancreas and its ability to produce its own insulin? No. And this is what becomes so frustrating because patients tend to get worse with time. Their sugars start rising even further, and they're even doing all the right stuff. If this is making sense, hit the subscribe button. I post videos every week that break this down in a way most doctors don't. Here's what we're seeing clinically. Patients who don't fit the typical profile still being treated the same way. People who are not significantly overweight, people who are eating well, people who are following the plan. And yet their blood sugar still doesn't respond the way it should. That's usually a sign that you may be not dealing with the typical insulin resistance pattern, but something different. And if that difference isn't identified, the treatment approach can miss the mark completely. So individuals will focus on trying to continue to lose weight, becoming more active by aggressively doing more gym exercises or cardiovascular work, and they just don't see the needle moving. And they go to their doctor and they ask what is going on, and they just push them more medications and driving more GLP-1s or metformin, or even giving them insulin. So the standard of care isn't addressing what's really going on. And what are some of those things that could be happening? Well, hidden drivers like inflammation, toxins, cellular dysfunction. You see, standard labs don't capture these. At this point, you might be thinking, how do I know if this is what's happening to me? And this is exactly where most people get stuck. They're given a label, but not an explanation. So I created a simple guide that walks you through the exact labs and markers we use to understand what's really driving your condition. You can download it for free using the link below this video. My goal is simply to help you understand what's actually going on inside your body. You'll see which markers really matter and why normal labs don't always tell the truth. Once you start looking at your condition this way, things begin to shift for you. You stop treating your diabetes as a single problem, a blood sugar problem, because we know that blood sugar is a symptom of your diabetes. It is not the cause. So there's lots of things you can do to reduce the symptom, but what are you doing to identify the actual problems that are going on? Things like inflammation, chronic infection patterns, toxicities, etc., that are driving your sugar to go up. So when you start looking at this differently, you start identifying the specific drivers so you can create the customized solution for your needs. And when you start doing that, when you start addressing the real problems that are going on, your blood sugar goes down naturally because your body wants to heal. It's just in some cases, it is broken and it needs support to restore that function. So then you're no longer just managing a label, you're understanding what's actually going on in your body. And when you address what's actually causing the dysfunction, that's when real progress starts to happen. Not by guessing, but by finally working with the right information. If this helped you understand your diabetes differently, download the guide below and start there. And if you want clearer, practical explanations like this, make sure you're subscribed. I post videos like this every week.